Let's study one of the most important topics in pediatrics, that is normal development in children. Why development is important? Development is one of the key pillars of pediatrics. Other pillars of pediatrics are growth, development, nutrition, and vaccination. As without them, we cannot provide a healthy future to the child. A normal development determines the progress of the child and hence the nation. Now let's see the age related nomenclature. Ovum. Ovum is called very first few days of life. Next comes the embryo, which is from 2 weeks to 8 weeks. More than 8 weeks we called as fetus, and the same unless the birth occurs. Perinatal period is from 22 weeks of intrauterine life to 7 days after birth. Many often you have heard these names given to a child based on his age or the group or the stage of life. Neonate. A neonate is the baby from birth to 28 days of life, and infancy is up to 1 year of life. Another term that is toddler, a child between 1 to 3 years of age. Then comes the preschool, that is from 4 to 6 years of age, and then comes the school going child, that is from 7 to 12 years of age. Another important term to be noticed here is the adolescence period, that is from 10 to 19 years of age. Now let's summarize what will we going to learn in this lecture. You can view this later also. Now coming to the definition. Now let's see the definition of the development. It refers to the maturation of the functions and acquisition of various skills for optimal functioning of an individual. Development can be summarized as what all the child requires to become an adult apart from just weight and height, that is the neurological improvement. Another concept widely being worked upon is the ECD, that is early childhood development, which is the development of physical, motor, socio-emotional, cognitive and linguistic development in the first 3 years of life of a young child. After studying the definition of development and why it is important, now let's study the common patterns of development, the principles. Now, coming to the principles, the development is a continuous process. A child grows gradually every day, every second. Development depends on the functional maturation of the nervous system, that is the brain function. Development has a uniform sequence, that is the pattern is same in all the children. Development starts from the head and to the toe, that is from the cephalocaudal direction. The attainment of certain reflexes or the certain milestones require the primitive reflexes to disappear. Like involuntary sucking needs to be disappear before the voluntary biting appears. Similarly, involuntary palmar grasp followed by appearance of voluntary palmar grasp or the grip. Now coming to the factors affecting the development. There are various factors affecting the development which can be grossly grouped as prenatal, natal and postnatal. Prenatal factors include the genetic, that is related to the genes or the DNA, and the maternal factors, that is related with the mother genes. Now the maternal factors affecting the prenatal growth are poor nutrition of the mother. A undernourished female becomes undernourished mother and later gives birth to an undernourished baby. This is a vicious cycle which needs to be broken to ensure proper health. Another important parameter is the anemia, which in mothers lead to deficiencies in babies. All nutrition to the baby is supplied from mother by the blood only. Hence, anemia leads to intrauterine growth restriction. Another term that is the recent pregnancy or the high parity, substance abuse like smoking, alcohol, etc., high blood pressure or what we called as pregnancy induced hypertension, or the chronic illnesses, pregnancy associated infections like TORCH, which is nothing just an acronym given to various infections during pregnancy which leads to fetal malformation. Now coming to the neonatal factors which include SGA, that is small for gestational age. A small baby can show delay in growth and development due to nutritional deprivement. Similarly, prematurity, that is the babies born before 37 weeks of gestation, are at high risk of showing delayed development. due to immature brain and increased chances of insult to the fragile brain. Another term, that is prenatal asphyxia or the birth asphyxia, can lead to the brain damage by causing delayed development. Hyperbilirubinemia can also lead to permanent brain damage causing neurological impairment. Now, let's see the third important group of factors affecting the child's development: infant and child nutrition. Indeed, nutrition plays an important role. Hypothyroidism, that is decreased thyroid hormone level, can lead to severe mental retardation along with other systemic problems. Another term, that is infectious diseases. More frequently the baby becomes sick, more will be his development affected. Toxins such as mercury, lead, which might be found in paints or petrochemicals, etc., can also lead to developmental delay. Trauma or the acquired insult to the brain, or other associated impairments such as a baby who did not hear will not be able to speak. Other factors like psychosocial factors, that is the parenting, the surroundings, the violence or the abuse with the baby, maternal depression, which often leads to child neglect and decreased milk production. Now, so far we have studied the negatively affecting factors towards the development. Now, let's see the protective factors. The protective factors are breastfeeding, which is the most important nutrition source to the baby, KMC or the kangaroo mother care, which provides warmth and increases the bonding between mother and the child, just like in kangaroo. Now, coming to another term, that is optimum nutrition. Another thing, that is absence of illness. Yes, absence of illness leads to better development. Secure home, a stimulating environment, that is playful, cheerful and lighted surroundings, that lead to more neurological synapses and overall brain growth. Educated parents, as all advices needs understanding, which comes by education. Now let's dive into the most important part of this lecture, that is domains of development. Development can be divided into five major domains: gross motor, fine motor, social, language, vision and hearing. Let's discuss one by one. The gross motor development. The gross motor development can be studied as per the age at which the gross motor milestones comes. Now let's see one by one. At 3 months, as can be seen in this photo, you can visualize the child is able to hold the neck, that is the neck holding. At 5 months, the child can show rollover. At 6 months, the child can show sitting with support. At 9 months, now the child can stand but with support. At 12 months, the child can stand without support. At 15 months, the child can stand and also walk without support. At 18 months, now he becomes notorious and the child searches for things in the drawers or he explores the drawers. At 2 years, the child walks up and down stairs but 2 feet per step. At 3 years, the child is able to ride a tricycle. And at 4 years, the child is able to walk, hop, or hop 1 foot or alternate feet going downstairs. You can remember it as at 2 years the child is able to walk up and down but 2 feet per step, and at 4 years 1 feet per step, and at 5 years the child can skip. Now let's move forward and see the fine motor milestones as per the age and the milestone. At 4 months, the child is able to have the bidextrous reach, as can be seen here. At 6 months, the child can reach with a one hand, that is unidextrous reach. At 9 months, the child can hold an object but with a immature pincer grasp. At 12 months, the child can hold a pen with mature pincer grasp, as can be seen here. At 15 months, the child can scribble or make a block of 2 or tower of 2 blocks. At 18 months, the child can make a block of 3 blocks, make a tower of 3 blocks. At 2 years, the child can make a tower of 6 blocks. And at 3 years, the child can make a tower of 9 blocks. And at 4 years, the child can draw a circle. At 5 years, the child can copy or draw a triangle. Now let's move ahead. Now let's see one of the most discussed topic in the assessment of fine motor skills, although it is old but still holds its importance, especially among the examiners. The good enough draw a man test. This test determines the child's mental ability to draw a human outline. Each detail is given a score. For example, the head is given score 1, eyes as 1, eyebrow as 1, mouth as 1, nose and 1. That is the each and every detail made by the child is given score as 1. Based on the scoring, the mental age is calculated as can be seen here. Although this method is crude but still can be asked, so do remember. Now let's see one of the another important topic, that is social and adaptive milestones, which child perceives from his surroundings and replicate as he observes. At 2 months, as can be seen here, the child smiles, that is he has social smiles. 3 months, the child recognizes the mother. At 6 months, as can be seen here, the child has stranger anxiety. At 9 months, the child waves bye bye. At 12 months, the child comes when he called. At 15 months, he has a speech which has non meaningful words and he simply blah blah blah, that is jargon. At 18 month, the child is able to speak and the child has a copies the parents in the task. At 2 years, the child basically, as can be seen here, he asks for the food. At 3 years, the child shares toys, knows full his name, and at 4 years, the child can play cooperatively and go toilet alone. At 5 years, the child helps in household work, dresses and undresses. Now coming to the language milestones. The language milestones, at 1 month, the child alerts to sound. At 3 months, the child basically coos. And at 4 months, he laughs loud. And at 6 months, the milestone, the child has monosyllable like ma, ba, pa, ta. At 9 months, now he can say bisyllable like mama, baba, dada, etc. At 12 months, the child can frame 1 to 2 words of with meaning. And at 18 months, the child has 8 to 10 words of vocabulary. And at 2 years, and now the child speaks with sentences, that is 2 to 3 word sentences, uses pronoun like I, me, you. At 3 years, the child asks questions, knows full his name and gender. At 4 years, the child can sing song, he can sing poem, etc. At 5 years, the child asks meaning of the words. Now coming to the vision and hearing, which is the fifth domain of development. Now first we study the vision. In the vision, we can study like age. At 2 months, the child is eye fixation. He follows the object but only up to 60 degrees. And at 3 months, he has a eye fixation of 180 degrees, that is he grasps with the eye. And at 4 months, the child has a binocular vision. And at 6 months, the child adjusts his position with respect to the moving object. And at 1 year, the child follows rapidly moving object. Now let's go ahead and study the hearing assessment. The screening with autoacoustic emission. Screening test is done at the newborn after 48 hours of life with OAE. It's a simple machine and is done with every newborn. Confirmation by ABR or the BERA. Every newborn who has a failure for OAE or who is suspected for having some defect in the hearing, or is a preterm, or is an NICU graduate, should undergo BERA. We should approach with 136 approach. And what is it? Basically, 1 is screen before 1 month with OAE. 3 is diagnose the hearing defect before 3 months. And 6 is start the treatment before 6 months. Now let's study what are the hearing milestones. That is a newborn, he startles, he blinks, he cries to the or he changes the activities as the sound appears. And at 3 to 4 months, he turns the head towards the sound. And at 7 to 12 months, he basically rolls over and responds by looking at his name when called